Hey there. Thank you so much for being here today. I'm Dr. Perkins, a board-certified OBGYN, and today we're talking about, can endometriosis cause ectopic pregnancy? Endometriosis is known for causing pain and a lot of discomfort with your menstrual cycles, but can it actually increase the likelihood of getting an ectopic pregnancy? Well, yes. And research, especially new research, is really giving us insight on this to a greater degree than we've ever known before. So in this video, we will be talking about what exactly endometriosis is. We'll talk about why endometriosis raises the risk of getting an ectopic pregnancy, and we'll talk about how pregnancy should be monitored in those with endometriosis. Let's first start talking about endometriosis today. I will first start by saying that endometriosis is a very difficult and challenging disease. It is very hard to communicate subjectively what you're feeling, and we don't have a lot of treatment options available. And so it makes it very, very, very hard all around to be able to find relief. And if you're having pain, I am so sorry that you're experiencing that, and I hope that between this video and your medical providers in your community that we can help to bring you relief. Endometriosis often means that tissue that should remain on the inside part of your uterus, tissue very similar to that part of your body, is found elsewhere internally. And I'm going to show you a little bit with my little model here, okay? This is our very unhappy uterus. This is the uterus here. The bottom part of your uterus is the cervix. We have two fallopian tubes. We have two ovaries. That one is smiling, that one isn't smiling so much, okay? But what I want you to take away from this model here is that, do you see these little red blobs that are around? Do you see them? I hope you do. Those are reflective of tissue that's similar to that which is found on the inside part of the uterus, that is found elsewhere on this uterus, but can really be elsewhere in the body, from your bowels to your diaphragm, your interior abdominal wall. It can be anywhere, your kidneys. And we think that this happens potentially because of what we call retrograde menstruation, which means when you have your menstrual cycle, bleeding occurs inside of your uterus and trickles out. When we have retrograde menstruation, this tissue is thought to pass through the fallopian tube and fall into your abdomen. And with all the movement of your internal organs, your bowels and your uterus and your bladder, it gets pushed throughout your abdominal cavity and will implant itself in those various areas. And so the tissue that's there doesn't just get, disposed of with our internal garbage truck system. They actually stay there and they implant themselves in the walls and they become really active. They cause a lot of inflammation. They cause a lot of scarring and adhesions. And when you get your period each month, these spots and implants are activated and they essentially try to have like mini periods inside of your body. And so because of that, pain is excruciating. This makes your period unbearable. It is not a fun condition. But because we're talking about ectopic pregnancy and endometriosis today, I'm going to put a pin here and just talk about ectopics, and then we're going to merge the two together. An ectopic pregnancy is a pregnancy that occurs outside of the normal place. Actually, let's bring our plush back. Normally, egg and sperm meets inside of the fallopian tube. Then after conception, they roll down the fallopian tube and establish and implant themselves inside of the uterus. Whenever we have an ectopic pregnancy, it means that after fertilization happened in the fallopian tube, the implantation of the pregnancy did not occur inside of the uterus. It happened somewhere else. This could be that the pregnancy remained trapped in the fallopian tubes and did not move forward. It could mean that the pregnancy happened by the ovary and established itself there, but that is not a good place to be. Sometimes it could be that the pregnancy attached in the cervix, or it could be in the bladder. I've removed an ectopic pregnancy right next to the bladder before. And so these are not normal things. And pregnancies cannot develop to full term when they're established anywhere else but inside of the uterus. And so most commonly, ectopics happen in the fallopian tube. Let's talk about ectopics and endometriosis and what increases the risk. As I mentioned earlier, with endometriosis may come a lot of scarring and what we call adhesions on the inside of our abdomen. Adhesions can cause blockages. They can cause blockages inside of our fallopian tubes. They can decrease the activity and the health of our fallopian tubes so that when pregnancy does and fertilization does happen, that the pregnancy isn't able to move along the fallopian tubes to get to the uterus because either the little hairs that moves the fertilized egg along are not working well, or the space inside of the fallopian tubes can be so narrow that the pregnancy isn't able to continue to move along. I mean, there's so many different reasons why endometriosis could increase the likelihood of an ectopic happening. And you know what? The data is even more compelling. Research shows that 55% of people who have had surgical diagnosis of endometriosis, which is really the true way to diagnose this condition, 55% of people had hidden endometriosis. What does that mean? Endometriosis that is not visible to us when we go internally and we look with a camera, a laparoscopic surgery, to diagnose endometriosis. So let me break this down a little. You come into the office, you have complaints of severe pain with your menstrual cycles, things that are concerning for an endometriosis diagnosis. We set up the surgery, we go to the operating room, we put a little camera through your belly button to take a look inside to see what we see. Looking for implants such as these on the inside. And so we look, we see, we're just like, yes, you have endometriosis. We see the implants on the inside. Oftentimes during that surgery, we will also excise them or take them out or burn them. We ablate them. The goal is to get rid of these implants wherever they are. Those are visible implants. Sometimes there is endometriosis activity within the tissue of the uterus that we can't see. Or it could be elsewhere in our system and it is hidden because visually we're looking for them, but we cannot see them. And if we go back to why we think that we get endometriosis, which is that retrograde menstruation, if you think about it, if this tissue that we can see internally actually passed through the fallopian tubes to get inside, then it's reasonable to think that there must be much more endometriosis activity within the tubes, more than what we can actually see or know that exists. I'm truly hoping that one day we'll be able to diagnose endometriosis much better or be able to identify the activity of endometriosis, because at this moment, ultrasound doesn't help, MRI doesn't help, CAT scan doesn't help. And so the only thing that helps is us going in visually to see them. But I'm hoping that in 20 or 30 years, we will have so many better diagnostics so that you won't need surgery for this diagnosis. So far we've talked about the scarring that comes with endometriosis. We've talked about the hidden endometriosis that likely exists. We've hinted to the fact that inflammation occurs in endometriosis. This is the baseline of what happens with implants inside of our body internally. There's a ton of inflammation that happens that leads to dysregulation locally where they are, as well as systemically. Now, even mild endometriosis can truly lead to an ectopic pregnancy because there isn't a correlation between your symptoms, the risks, and the degree of severity of your endometriosis. You can have one implant and have the most pain. You can have a ton of implants and have zero pain, or minimal pain. And you can have one implant and get an ectopic pregnancy. What is really more important here is knowing what to look out for if you are pregnant and you know that you have endometriosis. The first thing to know is that in early pregnancy, vaginal spotting can happen and could really happen in a normal pregnancy. It doesn't necessarily mean that there is a problem. In fact, about 25% of normal pregnancies that are able to go to full term, 25% of them may have some bleeding or spotting during the first trimester. Now, if that happens and you're also having left-sided or right-sided lower abdominal pain, this is concerning for a possible ectopic pregnancy. The pain usually reflects the side that the pregnancy is on. Now, you may be thinking, well, I've had a pregnancy before, or I've heard of people having cramping during pregnancy. That is very much true. Usually a normal growing pain in pregnancy is more midline in the lower abdomen. It's not on one side or the other. Asymmetric pain on the right or left that is persistent and worsening over time is for sure concerning for an ectopic pregnancy. Another symptom or a group of symptoms to be aware of is feeling lightheaded, feeling dizzy, or feeling right-sided shoulder-like pain. The reason why that may happen in an ectopic pregnancy is that an ectopic pregnancy may rupture and cause bleeding inside. When blood is in the abdomen and potentially touches our diaphragm, it causes right-sided pain. And so if you have right-sided pain, and for sure if you're feeling dizzy or weak, it could mean that you're having bleeding internally that is happening because of an ectopic pregnancy. And so that requires emergent, not urgent, emergent medical care. And so any pain in early pregnancy that's one-sided, especially when you have endometriosis, really requires that we get an ultrasound and blood work really quickly so that we can rule out an ectopic and especially a ruptured ectopic pregnancy. If you know that you have endometriosis and are planning for a pregnancy, please talk with your providers before so that you can create a plan together so that your pregnancy is one that is safe and healthy and well. I'm so glad you were here and you listened all the way to the end. I have a free gift that I'd like to offer you for being here. I'd love to send you a copy of my ebook, Hormones Don't Lie, because we're hormonal, because we know that endometriosis and fertility are also very much linked with our hormones. I'd like to help you on that journey by offering you this free ebook. It will give you lots of strategies to help you along the way. If you'd like that, just click the link below this video and I'll send it your way. Thank you so much for listening in today. It's been a pleasure.